Hi there, my name's Rebecca McIntosh and I'm a project manager at the Australian Cancer Survivorship Centre based at the Peter MacCallum Cancer Centre in Melbourne. Now let's talk a bit more about the details of the needs assessment strategy. So this strategy was developed through the co-design process, which involved patients, carers and health professionals. The strategy is about empowering patients to identify their own needs when they're ready, recognising that the timing may vary for different people. Evidence-based tools can provide prompts to assist patients with identifying physical, emotional, social and practical needs, and may help patients to consider needs that they may not have thought of. The strategy involves two steps. The first step is for health professionals to introduce needs assessments to the patient via a conversation, and a one-page resource on needs assessment is to be provided to the patient to review. The second step is to revisit the discussion at future follow-up appointments to understand if the patient has had a chance to review the material, has attempted the needs assessment, or has completed it. The first step is to introduce the needs assessment to the patient via a conversation and to provide a one-page resource for the patient to review. The patient is encouraged to complete the needs assessment when they're ready. WeCan, an Australian supportive care website, has the distress thermometer and problem list tool online. Once completed, it can be printed or emailed to the patient. The link is provided in the one-page resource for patients to access. It also includes links to useful tools and websites and local services that will provide patients with support and information to self-manage any needs that they identify through completing the needs assessment tool. If the patient is not comfortable going online, please provide a hard copy of the tool together with the one-pager. Even though the strategy is introduced by the healthcare professional, it is patient-led in that it is up to the patient to complete the assessment when they are ready. By introducing the strategy and enabling patients to perform their own needs assessment, they are effectively empowered to prioritise and express their individual needs, seek help for those needs from various sources, such as those on the one-pager, their families, friends, community support groups. They can have better conversations with healthcare professionals who can hear about their needs from their perspective. It is important, however, that the tool is not viewed as just another form or a questionnaire, but as a useful prompt based on evidence to help patients identify their needs. This is a crucial point that could make a difference in engaging the patient, so please emphasise this when introducing the tool. Needs assessment informs the development of a personalised survivorship care plan. Together, they can lead to better health outcomes for patients. This is something that your site might work towards over time. The second step in the needs assessment strategy is to revisit the discussion at future follow-up appointments to understand if the patient has had a chance to review the material, has attempted the needs assessment, or has completed it. As needs assessments change over time, it's also useful to remind the patient to revisit the assessment even if they've done it previously. Together with your VICS survivorship lead, you will already be aware of this implementation checklist. Which strategy steps will your site implement for this pilot? For the purpose of this pilot, you may wish to implement both steps of the strategy if you can leverage existing processes to follow up. If not, the first step could be conducted during the pilot and follow-ups may occur thereafter. Who will be responsible for the pilot at your site? Who is the key service contact? That is the site lead, who's responsible for minimum data reporting. Who else is a member of your project team and responsible for delivering the strategy? Who is your senior site contact who has authority to authorise and endorse the required tasks? Where will the strategy occur? For which group of patients and when? For example, all breast cancer patients on their final day of chemotherapy who are attending the chemotherapy day unit. How will the strategy steps be undertaken? How will you identify relevant patients? Are there other parameters you may wish to apply? For example, you may wish to focus on patients who can speak English at this stage. If the patient asks for help to complete the tool, how will you address that? It is recommended that you have a common position that everyone at your site will adopt. For example, make an appointment to go through it with the patient at another time, or refer them to Cancer Council or their local GP. What tool would you like to use? The Wecan Distress Thermometer tool is available online, and a printed format is also available.